You're listening to the RN Mentor, a podcast designed to document and bring you the work and experience of some of the most influential nurses in our profession. We will be sitting down and having a discussion with the leaders of today's nursing world as they share their work, how they navigate their nursing path, and their views on the future of the profession. My name is Ali Tayeb. I am a registered nurse, United States Navy veteran, a Jonas Veterans Healthcare Scholar, and your host for the RN Mentor. Thank you for joining another episode on the RN Mentor podcast. Today we're being joined by Dr. Lisa Campbell. She is a professor and director of the Postmaster's Doctor of Nursing Practice program at Texas Tech University Health Sciences Center School of Nursing with a focus on population health, epidemiology, and health policy. Dr. Campbell also founded Population Health Consultants, LLC, a company committed to improving population health, and is also the immediate past chair of the American Public Health Association Public Health Nursing Section, chairperson of the Council of Public Health Nursing Organizations, and a member of the Alliance of Nurses for Healthy Environments Board of Directors. So with that said, welcome Dr. Campbell to the show.
Thank you so much. It's such a pleasure to be with you here today.
Yes, thank you. And for those who don't know, I have been following your work through Twitter. That's how I initially connected with you. And that is definitely a place for nurses to connect these days. So if you're not on Twitter, I think everybody should be on Twitter and build a huge nursing community there that are sharing information and supporting each other. So thank you for agreeing to be on the show.
You're welcome. Is it okay if I call you Ollie?
Yes, absolutely. Please do.
Okay. Thank you so much. Yeah, I would encourage everybody to get on Twitter because it's a great platform to meet people. That's how I met you and found out about your amazing work and your life. And honestly, I think it's a great way to enrich our personal and professional lives.
Right. I mean, there's other social media platforms, but I've really found Twitter to be kind of the go-to place. It's real time, people interacting, but you have to be careful at the same time. But again, finding the right people and connecting with them, has been very rewarding. If nothing else.
Absolutely.
Right. Fantastic. So with that said, I really, want to start talking about you and your professional career, an impressive professional career. And for anybody looking to learn more about Dr. Campbell, her full bio is on my website, and you can find her information there. So Dr. Campbell, I just want to ask, how did you get involved with nursing and what took you down the path of public health nursing specifically?
Well, first, please call me Lisa.
Will do.
Okay, because we're colleagues. So I've been a nurse since 1983. At like 37 years, it kind of blew me away the other day when I dusted off. I was cleaning out my jewelry box and found my nursing pin. And on the back, I had the date engraved. So it was March of 1983. Pretty cool. So I've been a nurse for a long time. Started out in the burn intensive care unit, made my way through critical care, various leadership positions, and then realized I really wanted to focus on geriatrics. So I got my master's in focus on geriatrics and administration and went on to get my geriatric nurse practitioner postmasters in the certificate program and just absolutely fell in love with that population. I started out in Galveston at a center where it had multiple stages of living from independent living to a nursing home facility. I got to teach family medicine residents about the care of the older population or the older patient, which was exciting. And I'll never forget I have to tell you about this. One of my favorite patients there, God rest her soul. Her name's Loretta. And Loretta and I became fast friends. And she was on the independent living side. So much so that at the time I was pregnant, she kept asking me about how I was doing. We established this great relationship. My husband even went to visit her. And I'll never forget what she said to me. She said, one of the most important things that we can do in life is be in relationships. And I think that was the main success for her life. And she died at 100, and I'll never forget her. You know how there's some patients that you interact with and some people in your life you interact that profoundly touch you, and Loretta was one of them. She was pretty amazing. So after my sojourn in geriatrics and becoming a nurse practitioner, I ended up doing preventive cardiology for a number of years, and really liked that. I did it with the adult and older population, and discovered that I was fascinated with the whole notion of preventive cardiology, like preventing cardiovascular disease. And then it dawned on me that I've probably always been a public health nurse at heart. It just took me a long time to get there. So in 2009, I enrolled and was accepted in the Doctor of Nursing Practice program at the University of Tennessee in Memphis. Completed that in 2011. And the strangest thing happened to me, though, when I graduated. Now, you would think that a nurse with 30 plus years that just got her DNP in public health nursing would be able to find a job somewhere, right? You'd think that.
You should be able to find a job somewhere.
Yeah, well, that didn't happen. I was so deflated. I was in not a good space. I knocked on all the doors. Yep. I applied for public health positions at the state. I looked on the federal website. I even applied for the CDC EIS fellowship, which is the Epidemic Intelligence Service. I really wanted to be one of those folks. And I figured if I couldn't find a job, I'd better make a job. So I started a consulting company, Population Health Consultants, LLC, and started just doing pro bono work, local churches. There was a homeless coalition that wanted to look at providing services for the homeless. So we worked and developed those. And I just used my skill set in that way in our community, which was one of the best things I think I ever did, was giving back in that way, because I gained so much. I gained confidence. I built a strong network, which is really important as we go through our career. And then something amazing happened. I got a call from one of the local judge, and he wanted to talk to me about the public health department. And so I went into the courthouse and met with him. And he said, "Dr. Campbell?" I said, "Yes, sir." He said, "I want to know how we can fix the public health department." And you know, you got to be careful. That's a loaded question, right?
Very loaded question.
I said, "Well, sir, I think it's a matter of building capacity and getting them outside into the community, because the community really didn't even know we had a health department."
Wow.
And they weren't really engaged fully in activities out in the community. So I ended up, long story short, I ended up getting a job as a consultant with the health department. I facilitated their community health needs assessment and improvement plan with 29 stakeholder groups. And we did that in a matter of 1 year, start to finish. And the amazing thing was I calculated to the hour how long it would take me to do that job. Isn't that amazing?
That is incredible.
But after that, it was so successful that the commissioners asked me 3 times to be the public health department director. And so on the third time, doing some negotiation, I ended up agreeing to do that. And they charged me with turning the ship. And I felt like I was turning the Queen Mary, you know. Wow, it was one of those kind of things. But the staff is tremendous there. Tremendous team. You just got to have a transformational leader and somebody that can think about how the public health department is an asset to a community. So that's what I did before I moved to San Antonio.
Yeah. So do you think, just as you're talking about the leadership component of this, was it how I'm trying to think of the right words. How was your previous experience? How did that contribute to you being able to be that transformational leader in that arena that was, fairly new to you, or the position was new to you? I mean, you've been nursing for a long time, and I think at every component of nursing, there's a public health nursing, whether nurses realize it or not. They are at when they contribute to the patient's education, when they contribute to the community education, they are acting as public health nurses. So how did that previous experience help you with that role?
So I've had a lot of leadership roles along my career. I started out early in professional organizations, became the first president of Texas Nurse Practitioners, and just subsequently, because I really believe as nurses, we should belong to professional organizations, or we need to belong to professional organizations to give back and to improve things. And if you're going to complain, you should have a solution. So I had a lot of rich leadership experiences in professional organizations, learned a lot of hard lessons, a lot of things I wish I had done differently. And then when I had this opportunity to become the public health department director, I reached out to some of my colleagues who had sat in similar positions and asked their advice moving forward. So I did, episodic mentoring sessions with my colleagues who were incredibly helpful. It helped me formulate a plan moving forward. I think the most important thing for me really was to gain the trust of the staff there, that team, to let them know what our objective was, to really listen to them. That was really critical in transforming that public health department together, because we did do it together. So that was really crucial. And in terms of the public health nursing, I really, if I could just build on what you said. So, in the acute care and primary care setting, nurses really do look at that individual patient. And what we do want nurses to do, especially now, is to think about the connection to the community. And many times they're working, we want them to work as upstream as possible. So, downstream the individual, and then they move midstream. So that's referring that individual who might need assistance with transportation, as or food pantry and so forth. And then going further up, that has to do with payment systems and so forth within that primary care and acute care setting. But the key is to jump that stream and to really focus more in the community as the client or the patient domain, or the population, as your patient domain, and really think about those bigger policy issues, because that's really what we did. We focused on the smoke-free ordinance in our city, which, as you know, is it's going to protect the entire community, not just one individual. So we really focused on that broad, overarching. And as a public health nurse, I always look at the system, the entire community and the population versus just the individual. So that's, I just thank you for indulging me. I just wanted to make that distinction, but it would be my goal for people to begin to think in that manner, nurses at all levels, to be able to think in that manner, as you described earlier.
That's one of the things that actually I talk about when I'm talking to my students, is really focusing on population health, because they can have such a bigger impact and a bigger understanding of, for example, disease management when they look at population health. Actually have my students look up income levels of different areas within the counties around the U.S. and looking at the population that way, because that has such a huge factor in that population's health. Going a little bit with that, what are some from a policy perspective? Because that's I think that's one of the most abstract things when we talk to nurses who may be bedside or in a hospital. Policies, right? How policies affect populations.
Right.
Can you give us a couple of things that you've worked on that you could think about, that policies that you looked at from a public health perspective that had needed policy changes to
Yeah.
really address the disease process or the health issues that were happening?
Yeah, so I'll talk about the health issues that ultimately affect the disease process. So you made some really good points. The first one I was describing was the smoke-free ordinance that got passed in our city. The thing I think that's important for nurses to understand is wherever they live, what is the jurisdiction? What is the rule of law within their own state? So as an example, Texas is a home rule state. So that means that if the city, so I live in San Antonio, so if the city of San Antonio wants to pass a smoke-free ordinance, they can put it on the ballot and the citizens can vote for it. Or it can be passed through city council. The best way really to do is put it on the ballot, honestly, so that your constituents support it. If, however, Bexar County, which is where we live, wanted to do a smoke-free ordinance then to cover everybody within the county, they're not allowed to do that in Texas because the counties are only allowed certain types of ordinances or certain types of rules that they can pass. It would take the state of Texas to pass a law that we had a statewide smoke-free ordinance. And until some things change politically in the state of Texas, that may not happen anytime soon. Although there has been some progress with, the sale of tobacco to, no sale of tobacco to anybody under the age of 21, the electronic nicotine delivery devices. That was something I tried to get added to our city smoke-free ordinance, was to add the e-cigarettes to that, which was unfortunately a learning experience, and we were not successful, but hopefully they'll move in that direction. The other thing, more locally, so let's think about, here's something I think everybody can relate to too. Another policy we worked on, we worked on many policies, but another one that's more tangential, I think, especially for a nurse in the acute care setting, is mother-friendly workplace policies. Mm-hmm. Okay. So, we want to have healthy moms, healthy babies. And the best way to do that is for the mom, if she can, right, and chooses to do that, I want to always make that caveat, right, is to breastfeed. And so in order to do that, we have to have mother-friendly workplace policies that support a mother's decision or a woman's decision to breastfeed. And it's really interesting how you can create a little competition with your local hospitals. So let me back up just one step here and think about the system. So as a public health nurse and public health department director, the local public health system isn't just the public health department. As you know, it's law enforcement, it's local schools, it's nonprofits, it's healthcare system. It's the entire system put together. All the sectors in your community, faith-based organization, all those sectors, right? Okay, so we can kind of spur a little friendly competition with our hospitals if we're creative and we do it right. So what I did in order to move in this direction, so we had WIC, Women, Infant, Children Nutrition Program within the health department. I worked with our WIC director, and I had two of our Doctor of Nursing practice students who took on this policy to present the pros and cons of mother-friendly workplace policy. They had even implemented in their organization. They had taken pictures of what the room looks like in the hospital. They were able to describe their policies to other nurses at the hospitals in our community, which was really important. Nurse to nurse, so, kind of dialogue. So I convened a meeting at our health department with our WIC director the two Doctor of Nursing practice students came in so I was in Victoria, so that's South Texas. So they came in from Dallas and Austin respectively, which was amazing. They presented this to the nursing directors for maternal child services at both hospitals that were there's definitely competition between the hospitals. So it was very well received. And they also agreed to provide technical assistance to both of these hospitals, sample policies, any way they could support. Well, I'm happy to report to you. Now, it took a number of an additional probably 6 to 9 months. But before I left that health department, and I was there about 15, 16 months, both of those facilities became mother-friendly facilities. And we helped our county become a mother-friendly facility. And we were targeting the 5 largest organizations to try to help them as well. So we can, as nurses, we have an opportunity within systems to look at policies that, like this one, that support a woman's decision to breastfeed, which helps create a healthy community, right?
Absolutely.
Healthy population. So that's a policy I think that's really important. There's other policies. There's transportation policies. We can work with local governments about transportation, resource access for communities in resource poor zip codes. We can look at those kinds of things creatively. I think it's really just expanding the way that we think about health in our community and what it means to create healthy communities.
So you touched on a really great point of public health really being multifaceted with various types of disciplines that are involved with it. From a nursing perspective, because public health nursing is a very niche population, but we have 4 million nurses across the U.S. and most of them are not public health nurses,
right?
Even though they may have some of the knowledge behind what public health nursing or what public health needs are. How would you mobilize nursing in general to be more involved in things like policy and advocacy for population health? How do we mobilize them? Because they're not in a role. They may be at bedside or they may be in a specialty area where they're very looking at very specific things. So how do we mobilize nursing in general to look at things like that and be more involved?
Okay, so I have 2 points to make on that. I have a colleague who's really brilliant, Dr. Shawn Knipe, and you may follow her on Twitter too. And as we've worked on providing instructive input rather, to the Future of Nursing 2020-2030, which, as you know, they're focusing more on the social determinants of health, which really are they're different than social needs, right? They're very upstream policy, which people get that confused all the time. But she asserts, and I believe she's 100% correct, I agree with her on this, is that if we're asking nurses in the acute care setting to work on those social needs or social determinants, even more upstream policy, there needs to be a percent allocation of their FTE to do that work. We keep asking people to do things for nothing, and nurses are great about doing things for nothing. And believe me, I have given away, I cannot tell you how many countless thousands and thousands of hours, okay? But I do believe it's time to rethink some of that. And now, especially with the COVID pandemic really shining the microscope or magnifying glass on the disparities that exist in communities where Blacks and Latinos and others are disproportionately affected by COVID. They have the disease, sometimes anywhere from 60 to 100%, depending on the zip code.
Right.
We have to be intentional about that work. We cannot go back to the status quo. We cannot go back. We have to address structural racism and those types of things that are underlying for these disparities. So in order to do that, I would say that acute care settings, just like higher education and nursing, need to have social missions. And that means that you're allocating time to work on that, right? To build those networks, to work on those policies. So that's the more larger picture. But now let me get back to what you asked in terms of the advocacy. Because many of us, just like you, belong to professional organizations, right? And in that professional organization, we engage in advocacy type efforts. Many of those are instructive, right? We want to tell you why this is important so that we can, for example, with the CARES Act, we're working on messaging not only inward facing toward nursing, but also outward facing toward organizations around why it's important to take some of that funding, right, specifically that's focused at public health, to increase, to bolster and build up, really restore the public health nursing workforce. We probably got around, I'm pulling this number out, I can't remember the exact number, but we're probably around 30,000 nurses in state and local health departments that are public health nurses. Right. That's abysmal. So what can we do as nurses? Well, first of all, join a professional organization. And I believe nurses need self-efficacy. They need mentoring in doing it, right? Each one teach one. So my role and my commitment to the nursing profession is to teach and mentor people in doing the process. Many times, you might get called to do a press briefing or talk to a representative or whatever it is. And you need somebody in your network that you can call up who's done it before to say, here's what I'm thinking. Here's my 3 talking points. What do you think? And they can bounce it off and they can give you support as you go in to do that activity. So I believe the mentorship is really important, and also being involved and a member of your professional organization is critical. And establishing local relationships with your elected officials locally when they're not in session. So go to their local office, call them up. I've got them on my phone. I have their phone numbers here. I call them up. And sometimes they don't like what I have to say, but we have to express that as a constituent, right?
Absolutely. No, I agree. And what I like to, one of the points that you made that I really like is that active participation. So I know, like I was, when I see student resumes and I'm looking through things and I see memberships, and I always go back to them and say, how are you actively a member of this organization? And they say, oh, I just pay my annual dues, which is great because it still supports the organization. Yeah. But I think the real richness comes from the experience of being actively involved in various committees or even getting the word out about what the organization is about. So I think that's where the richness of the mentoring comes into place. I think that's what you're addressing.
Absolutely. Absolutely.
So just since you brought this up, and I've had an opportunity to talk to my local representative a couple of times, how do you do that cold call, or how do you do that initial reach out? Because my first time was extremely awkward. I didn't really, you put these local representatives on this pedestal, and trying to equal things out the first time I called was a little bit weird. How would you recommend somebody who's never done something like that before?
Okay. So first, I want you just to imagine. I'm gonna walk you through the scenario. Okay, so you've never called your elected official. The first thing I think that's really important is that you go on to the internet and you look up your elected official is going to have some kind of web page. Look them up. What's their background? Can you find out? Is anybody in their family a nurse? Or maybe there's something in there that indicates that they had some kind of interface with the healthcare system, right? Maybe just see if there's something that you have in common with that elected official, besides being an important constituent voting member, right? And so I remember calling up my elected official for the first time in Victoria, who I wasn't really happy with because I was frustrated. And I said, hi, I'm Lisa Campbell. I'd like to make an appointment to talk to Representative, Morrison. We're actually neighbors, and I'd like to make an appointment to come into her office. So I went into her office, and I went in. Actually, don't go in if you have a complaint. Go in with the solution. So I went in with this situation we were having with the Texas Railroad Commission, which, by the way, they don't regulate the railroads. They regulate oil and gas. Pretty sneaky title, isn't it?
Wow.
Yeah, right? So I went in and I said, look, we have these 5 groundwater districts. We're asking for a rule change. The Texas Railroad Commission refused us. I mean, we worked with the law clinic at UT. They refused us, summarily refused us in 2 days. We weren't asking for anything onerous. And by the way, the groundwater districts were put in statute by the Texas legislature. Go figure, right? It's like, I don't know. I think they don't know what they do half the time. But anyway, I went in to meet with her and I explained everything. And she assured me that she would help me navigate it or get meetings. But I have to tell you, that didn't go very far. And when I left, do you know how nurses have intuitions that we should always trust? You know what I'm saying?
I'm quite familiar with that, yes.
Okay. Well, I just had this feeling that just fell on deaf ears. But it didn't keep me from trying. I had repeated interactions with this representative and repeated it, Yeah, it's awkward. I will tell you, the most awkward it can get is when I feel emotional about a situation. And so I try to really step back and try to be objective and check my emotions at the door because they get me in trouble every time.
Right.
So I think finding that common ground. And the other thing, just remember, they're no more important than you are. Just because they got elected doesn't mean anything.
Right.
Yeah, they could get unelected in the next go around, right?
Absolutely.
And by the way, I want to put one plug in here for your listeners. I think we need more nurses locally to run for office like school board, city council. You don't have to run for a state office, but can you imagine what would happen now in these cities with nurses on city council when mayors are trying to make decisions about COVID-19, sheltering at home, wearing masks, all these kinds of things? We can inform that. I think we have to remember, same thing with school boards. Those are really important. Those are important positions that we could occupy those seats. So I would say if anybody has an aspiration to do that, start locally.
Yeah, actually, I have a colleague of mine who's running for office, and then that's one of the things actually I was trying to do is get a few people that were nurses in political roles on the show and having them speak to what it took, because I think more nurses should be in those roles because, we're so there's a stereotype that they look at when we talk about nurses. Nurses are in hospitals and doing direct patient care. But in reality, I always have to tell when I'm teaching, especially, really talk to my students about the extensive role of nursing, like worldwide, like in almost in every sector, how nurses have impact. So I completely agree with that.
So I want to say one thing. So you notice on nurse Twitter how some of our colleagues remind us that nurses don't only practice in a healthcare or medical care setting or public health. They can be in, hired by grocery chains. They can be hired by, industry, in a range of settings. And I think about a colleague of mine who works with a team of architects to develop acute care, hospitals, veterinary medicine clinics, and they design these facilities. She's part of an expert interprofessional team. So nurses really, there are so many opportunities for nurses to practice in many domains, and sometimes organizations don't even know that they need a nurse until you tell them what you could do. Even if they have a position open, actually a nurse would be exceptionally qualified for a lot of these positions. I know several colleagues who have approached organizations and they hadn't thought about a nurse, and they basically pitched themselves and they got this amazing job.
Yeah. And especially when we have nurses that come into nursing as a second career, they
Yes.
already have the business side or I actually talked to a colleague of mine who is a nurse now, but he started out as an artist and did that for many years, sculptures, paintings, stuff like that, and then got into nursing. And so they're all varied backgrounds.
Right.
So I think there's always opportunities for nurses to take advantage of both skills and experiences. Yes, absolutely. That's fantastic.
Yeah.
So I want to move us towards
Yes.
what's going on in the world now
Yeah.
as we all shelter in place with COVID-19. We hear a lot about nurses going to hospitals and being celebrated, but I know public health nursing is a whole different animal that we're really not seeing. We know they're there. We know where they're doing their work. But what's going on in the public health nursing sector during this crisis?
Yeah. So that's really important to address. When this all started, the COVID-19, we know that, and I said it on BBC World, that we didn't have enough testing. So we have to do two things. We have to contain the spread and we have to mitigate the surge in our hospitals. So containing the spread means we have to identify cases and do contact investigation with those cases. And then we have to give them instructions about quarantining and making sure that they have everything they need to maintain at home, from food to their medications to whatever. And so people really often forget the important role of public health nurses in that space of contact tracing. So that means that if you're a case, just in case, just so we have common ground on this. So if you're a case, that means I'm going to call you up and find out, ask you some questions to try to determine who might have exposed you. So as an example, many people that are called now, because I listen to my husband make those calls, he volunteers to make those calls while I'm working. Many people actually, they either know they got it from a family member because the family member's sick and now in the hospital or sick recovering, or they got exposed at work, or they were in the community and they have no idea how they got exposed. A lot of people that are getting called, they have virtually no symptoms or they're subclinical. So it's really important to determine who the contacts are because they need to be reached out to get tested and to be quarantined. So that's how we contain the spread. We minimize the spread of the disease. So that's really important. That's what public health nurses are doing. But here's the other thing that's the kicker. So we have essential public health services that we provide at the local or state level, depending on depending on how the public health system's set up in any respective state. So in Texas, we're decentralized. That means that we have 60 local health departments that cover maybe around 100 counties, let's say. We have 254 counties in the state of Texas, and we have 11 public health regions that then will cover all those additional services. So as everybody's attention's diverted to the COVID response in public health, and there's a lot of things besides the contact tracing that we're doing in terms of preparedness and response, while they're diverted there's still those essential health services that need to be done. So public health nurses are having to work 12 to 14 hours, 7 days a week, not only to respond to COVID, but to cover those other essential public health services like TB control, vaccinations, immunization program, any maternal child health, WIC, any of those other services, any kinds of community services and programs that are put in place. So that's really what we're having to do. Public health is having to set up the testing. They're having to figure out referral. They're having to do all this. Many states are prepared better than others, but the bottom line is we do not have enough tests, and we don't have enough public health workforce in order to respond appropriately and meet the other essential community services that we provide. So talk about strapped. We're seriously strapped, It's a problem.
Yeah, I mean, I can definitely see. I know, like public health nursing, just in general, as we mentioned before, as the numbers are low. They should be
Hmm.
a lot higher, just because of everything that's going on, but especially with COVID-19, because I know there's a lot of legwork involved with that, very time consuming, plus all the other things that are going on, as you mentioned, still need public health nurses' attention. So,
Right.
so it becomes even a bigger issue.
Right.
Um,
Because we're seeing, unfortunately, because parents can't, or the guardian of the children can't take these kids out to get vaccines. Now we have kids that are behind in their vaccines. Well, what is that going to do to, vaccine preventable diseases in children
mm,
and herd immunity and community spread? I mean, we've had pertussis outbreaks, we've had measles outbreaks. How are we addressing people that are either vaccine hesitant or anti-vaccine? How are we addressing maternal child services that are so important to people? Wow. We could go on forever with that, but it is problematic because we're strapped and now we're having to, I see it as these little threads about ready to snap because there's only so much that you can deliver with so little people, with so few public health nurses.
Absolutely. It just sounds like we need like a whole different plan. And I don't know, I'm not in the loop of what the cities and states are necessarily doing for post COVID, just from a perspective of things like immunizations, like how do you catch millions of children up on their
Mm-hmm.
vaccinations, and how do you, address all the other issues that are going to be related as a result of people not getting the services that they would have normally received during this time. So I don't know what the plans for those are, but it sounds like something that people definitely need to start planning now. If they
Right. And part of what we're doing in the public health nursing section is advocating for the CARES Act funding to be that's drawn down from the federal to the state to the local level to help bolster the public health nursing workforce and do more workforce training because you could do place-based immunization clinics where you're going more into the community where you're not asking to come to them with nurse strike teams to increase the to catch people up. There's a lot of things we could do, but we have to have the capacity to do it.
Right. I know California, for like the Bachelor's of Nursing program, they have a public health nursing component to it. So when they finish their bachelor's, and I'm not sure if every state has it, but some states also have a program like that. How do you think academia might be able to assist? Is there a place for academia to fill some of that gap uh, for public health nursing? Um, your thoughts?
Okay, so can you hear me okay?
Yes.
Because all of a sudden, okay. So I'm going to say something that I'm going to just strike right at the heart because I'm a direct person. Are you ready for this? So unfortunately, academia, nursing curricula has been very acute and primary care focused
I agree.
and has almost all but erased community public health nursing. It's almost like an afterthought. Many times nursing educators that teach those courses may have little to no experience in those domains, those practice domains. So it's really important for nursing academics and nursing schools of nursing and nursing curricula to really bolster public health nursing in their curricula and really feed it through. I think there's a creative way that we can do that, but it has to be valued at the same level of acute and primary care. And that's not what's going on right now. If I could say one thing, it would be valuing that domain, that practice domain for nursing.
Absolutely. Well, thank
Is
you
that
so much.
is that
Yeah,
correct? I'm just being
no, no.
honest.
I think you're preaching to the choir. So yeah, yeah. There's definitely, I think, public health should be a much bigger. I mean, originally we had set up, I think, academia for the acute care setting, and we just never moved away from that. There is definitely a place for acute care setting. I
Oh
know
yeah.
my the university I teach at, we just added ambulatory care, and we talk a lot about
Good.
but it's an elective, however, as part of a grant. But again, it's something in addition to that I think students value. And I think it's a great experience. But public health, again, I think is one of those components that we definitely need to spend more time on, and the social determinants of health with the new Future of Nursing report that's hopefully coming out soon.
Or maybe, who knows with COVID-19, right?
Oh,
It
yeah.
might be a little delay. We never know, right?
You never know. You never know. So hopefully things will stay on track, and so a lot of we'll wait and see, but hopefully nurses take a stronger stance with everything going on and being a proactive in the community. I think that's very important. From public health to acute care, I think nurses overall need to be more involved in the community settings.
I want to leave you with one thought, because you were asking we were talking about a little bit about mentorship, and I said usually I do. It's almost like an episodic drive-through kind of mentorship with my colleagues. But there's something I was thinking about. Mentorship sort of happens organically, right, in those relationships. So what Loretta said, that relationships are really important. I firmly believe that and practice that. And I believe that a mentor walks beside you. The mentor never walks in front of you.
Absolutely. Yeah, I definitely agree with that. Yeah.
So I just wanted to leave your listeners with that.
Well, I appreciate it.
Yeah, you're welcome. This has been awesome. Thank you for having me.
Thank you. Thank you for joining us. And I look forward to continuing our virtual relationship through Twitter. And maybe down the line, we'll actually get to meet.
Yeah, I hope so too, Ollie. Thank you so much.
Thank you, Lisa. So again, we've been joined by Dr. Lisa Campbell. Her information and bio is available on my website. And that will conclude another episode of the RN Mentor podcast. Thank you and have a fantastic day. You've been listening to the RN Mentor with your host, Ali Tayeb. Please don't forget to visit www.alirtayeb.com. That's www.alirtayeb.com for podcast notes and resources. And don't forget to subscribe. Until next time, I wish you fair winds and following seas.